Information. Nowadays with the internet, there is considerable information about healthcare, alternative medicine, do-it-yourself, and other such things, and it is important to be able to distinguish what is right from what is wrong. So the big question, is the material presented on the internet, in this site or that site, or in some newsletter that you open in the mail, is that a legitimate set of facts, or is it quackery? There is no obvious answer without a strong medical background, and organized medicine will rarely cooperate with its competition. So let's look at some important differences. The quacks. Material is presented with great preamble. I am going to tell you something important, blah, 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 and 100 words later, or a minute later if you're watching a video, you don't have a summary or other description of the important content. You don't know specifically where things are headed. The content itself, when it finally shows up, is needlessly complicated. You must pay in money or give out your email address. Caution, there are some reputable of content sites that ask for money. The quack theory will probably violate principles of biochemistry. Often, but not always, a principle not consistent with known and obvious chemistry and physics laws is mentioned. Biochemistry is complicated, but it always follows the rules of basic science. No exceptions. It always follows the rules of basic science. Homeopathy is an example. Homeopathy says the more dilute a potion is, the stronger it is. Even if the potion is so diluted that, chances are, the vial that is used doesn't have even one molecule of the active ingredient. There are people who believe in homeopathy. There may be some specific homeopathic remedies that work. These remedies should be assessed on their merits without a blanket approval of the entire homeopathy theory. With the quacks, there may be a reference to being repressed by organized medicine, but no reference to the legal details, the court name, the docket number, the laws violated, and the specific legal actions taken to repress it. So you cannot do any research about the specifics of the repression. The repression may not exist, or it may be based on good scientific reasoning and consumer protection bureaus, medical license bureaus, and such who have a good reason to fight the quacks. And the quacks don't want you to learn that the repression is legitimate. The design of the internet site contains attention-grabbing distractors, including motion and sound. There may be pop-up windows, and there may be a, "Are you sure you want to close this window?" pop-up window when you try to leave the internet page. Testimonials are positive and overflowing with emotion. But there is no reference to impartial literature, no published studies, no evidence of their existence in legitimate journals or books. The honest sources. Material is presented in a straightforward way. The material may be complicated, but there is an undertone suggesting an intent to keep it as simple as possible, even if it is difficult to understand. There is no coy vagueness, no silly ambiguity, and no preventable difficulties in explanation. Specifics are available without your having to pay for them. The theory is clearly shown to obey obvious principles of biochemistry. Organized medicine usually ignores alternative approaches. Suppose it fights and loses. That happened with chelation, for example, in Florida. If there are legal challenges noted on the website, so are references to court dockets and other things that the source can refer to but not invent. And you can check out those court dockets and the litigation and verify what's going on and who is doing it and why and whatever you like. The honest source will not mind disclosing the litigation and other fighting that is going on. The internet site is perhaps complex, but is clearly straightforward with little or no gimmickry. As with the explanations, There is an intent to provide information, but an undertone of wanting to keep things as simple as possible, even though there is some unavoidable complexity. Testimonials are positive, sometimes qualified rather than fully supportive, and refer to facts about the patient and probably other medical facts as well. References are made to legitimate journals, books, news articles, and such. The ultimate screening, your feelings. With all the hoopla about evidence-based medicine, science, credentials, and so on, this one asset of yours is seriously underrated. In school, in the doctor's office, in social gatherings in which people are outranking you in a social pecking order, it is easy to learn that your feelings are unimportant. They are not. They are part of you, and while they sometimes need to be set aside, they should not be ignored. When you encounter an opinion or a recommendation about health care, on the internet, at the doctor's office, wherever, how do you feel about it? Your feelings about an opinion or a recommendation are important. So here's what you do. Think back on political campaign statements and promises. How did various politicians make you feel when they made their campaign statements, when they made their speeches? The same as how this opinion or recommendation from a healthcare person makes you feel? Think back on a political campaign in which the candidate was elected and kept his or her promises and did a good job in office. Remember your feelings during the campaign? Now think back on a campaign in which the candidate was elected and proved to be dishonest. Remember your feelings during, not after the campaign, during the campaign. Does this healthcare opinion or recommendation incite feelings like that of the honest politician running for office? Or does it remind you of a hypocrite or a charlatan running for office? Subliminal, unconscious messages exist. Trust them. Perhaps you will not know why you feel as you do, but your feelings are nevertheless credible and trustworthy.